What's that? It had to, right? But at any rate, people wonder where this 28-day cycle came from. Why 28 days? Why not 10? Why not 40? You know, so why 28 days? Okay, first of all, there are 3 phases, and we're going to talk about the menstrual ovarian cycle interchangeably right now. And the first phase, of course, starts here, say around day 0 to day 5. This is going to be the menstrual cycle. Specifically here, what is happening?
Release?
Not
having a period.
Having a period, yeah. The first 5 days, we start with day 0 here as being menstruation. And by the way, the start of menstruation is what we call menarche. That occurs in puberty, typically for females around age 11 to age 14.
Or it used to be, anyway.
Yeah, it used to be.
Now it's like 8 years old.
Yeah.
All those MSGs and preservatives in food.
And what that does to growth in general. During menstruation, part of the endometrium lining is sloughed off. The blood vessels kink and die due to loss of hormones. So, of course, that blood and mucosa lining of the endometrium is lost during menses. Kind of an interesting thing because there's 2 cycles playing out here simultaneously. We have what the ovaries are doing, that's called the ovarian cycle. The ovarian cycle is using FSH and LH. The menstrual cycle is what's happening with the lining of the uterus. That particular cycle relies on estrogen and progesterone. So we actually have these 2 playing off against one another. They're, of course, interlinked with what they're doing in the female's reproductive system. After a female's menstrual cycle is over, we go through a period called proliferation. And during this time period, what happens to the lining of the endometrium? Grows and thickens, yeah. So that lining of the endometrium grows and thickens.
Didn't she from 1 to 5, she just lost the lining.
Right.
So now she's about to grow it right back.
She can grow right back. Okay, so in the ovary, there is a competition between developing oocytes. So I'm going to draw here what a follicle looks like. In the ovary, you have a ring of cells. And as your oocyte develops, the follicle is developing along with it. In fact, the follicle is what's developing that oocyte as the female travels from primary oocyte stage to the secondary oocyte stage. So the follicle in the ovary is a ring of cells. It surrounds an egg to be. So what happens when that follicle develops to the point of rupturing?
Egg is released.
Egg is released, right. And are we releasing a primary oocyte or a secondary oocyte?
Secondary.
Yes, secondary oocyte. What day does that occur on? About 14, right.
Plus or minus 5, right?
For most women, it's somewhere 14, but yeah, it depends on the length of the cycle, the whole cycle.
So if the follicle ruptures, the oocyte.
Oocyte is ejected, yeah.
So on day 14, it's let loose, and right before that, the endometrium started thickening up in preparation for it.
Right, right. Okay, so at day 14 here, the follicle is ruptured, the oocyte is ejected from the ovary into what?
The fallopian.
Right, fallopian tube. We also need to take a moment and pay attention to what's happening with the hormones here. So around day 14, there's going to be a surge in hormone levels. All right, so this is where we're going to just map in some stuff. On or before day 14, LH surges. Keep in mind, GnRH coming from the hypothalamus promotes the release of LH from the anterior pituitary. And about the same time, there is also a spike of FSH. What does FSH stand for? Good. Follicle stimulating hormone. If you remember that the name there stands for follicle stimulating hormone, that's exactly what FSH does. It stimulates this follicle to release the egg. I'm going to move my pointed egg so we have room to rise.
What is ovulation? The egg leaving the...
Egg leaving the follicle in the ovary, and it's literally spit out and then it travels now down into the fallopian tube.
That's all it is?
That's all that is. At ovulation, the cervical mucus that keeps the cervix area closed is actually open for about a day. So cervical mucus thins. Body temperature also spikes around the time of ovulation. And then as you can see here, we have a spike in two hormones, FSH and LH. So there's a whole combination of symptoms that accompany ovulation. It typically occurs about 14 days after the first day of a woman's menstrual cycle. Even if you have a 35-day cycle, or if you have a 15-day cycle, ovulation is fairly routine, and you might say, for most people. It's typically around day 14 after the first day of the menstrual cycle. What happens between day 14 and day 28 depends. If there's no sperm in the environment, let's take that particular course here.